Swelling of hands and fingers, 13 main causes and what to do. Having swollen hands and fingers is a reactively common condition that arises primarily from fluid buildup or inflammation caused by poor blood circulation. Thus, this type of swelling is more frequent in those who consume excess salt or in women, due to hormonal changes that occur in PMS, for example. Swelling usually goes away with simple measures like raising your arms and opening and closing your hands in repeated movements. But in some cases it can be a symptom of more serious conditions such as arthritis, tendonitis, high blood pressure or heart failure. In these cases, it is necessary to follow up with a doctor to make the most appropriate treatment. Therefore, it is important to be aware of the symptoms that may accompany swelling, such as tiredness, difficulty breathing or pain. For example, as they may indicate more serious conditions that need medical treatment. Swelling of hands and fingers, 13 main causes and what to do. The following are the main causes of swollen hands and fingers. 1. Poor circulation. Poor circulation is the most common cause of swelling in the hands and fingers and occurs due to the body's natural aging process, in which the veins lose elasticity and become more rigid, making it difficult to carry blood from the arms to the heart. They accumulate in the arms, causing swelling in the hands and fingers. What to do: moving your arms, hands, and fingers every hour, lifting your arms, opening and closing your hands, can help prevent swelling in your hands and fingers. You can also do massage or lymphatic drainage to activate circulation. Learn how to perform lymphatic drainage at home. 2. High temperatures in summer. During the summer, it is very common to get swollen hands and fingers, and this is because when the temperature is higher, there is a dilation of blood vessels, bringing more blood to these areas, causing swelling. What to do: raise your arms, opening and closing your hands to facilitate the return of blood towards the heart, massage hands and fingers or lymphatic drainage. In addition, it is important to maintain a good fluid intake throughout the day and eat a balanced diet to avoid fluid retention and swelling of your hands and fingers. 3. Excess salt. Too much salt in your diet can cause swelling in your hands and fingers, and this is because salt contains a lot of sodium that retains water. So if you have it in large amounts in your body, it increases fluid retention. What to do: a good option to prevent fluid buildup on your hands and fingers is to use low-sodium salt or use herbs to reduce your salt intake or avoid adding salt to meals. Watch the video on how to prepare the herbal salt. 4. Physical activity. Physical activity, especially while walking or jogging, makes the body work hard to pump blood to the heart, lungs and muscles, which need more oxygen during exercise. This causes a decrease in blood flow to the hands and fingers, causing the blood vessels to dilate, causing swelling. What to do: raise your arms by opening and closing your hands during physical activity to stimulate blood circulation and prevent swelling of your hands and fingers. 5. High blood pressure. High blood pressure is a common disease, especially in the elderly, and occurs as a result of a natural aging process in which the arteries are less flexible and stiffer and the heart needs to beat harder to carry blood to other parts of the body. When blood reaches the extremities such as the hands and fingers, it can be caused by the blood vessels' difficulty in bringing the blood back to the heart, causing swelling. What to do: high blood pressure should be treated with medications prescribed by the cardiologist. However, physical activities such as walking, losing weight, cutting down on salt intake can help control blood pressure and reduce swelling in your hands and fingers. 6. Carpal tunnel syndrome. Carpal tunnel syndrome occurs when the median nerve that runs through the center of the hand is compressed, affecting the sensation of the thumb, index, middle and ring fingers, and can cause swelling in the fingers and hand, in addition to pain, numbness, tingling and burning sensation. What to do: a wristband can be used to immobilize the wrist and help relieve pain and swelling in the hand and fingers. In addition, you should consult the orthopedist, who should indicate the treatment that can be done with the use of drugs such as ibuprofen or paracetamol, injections of steroids or surgery. 7. Arthritis. Arthritis is an inflammatory disease that causes pain and stiffness in joints, especially in the hands and fingers, leading to excessive swelling of the fingers, as well as symptoms such as decreased movement of the hands and fingers and reddening of the skin. What to do? A rheumatologist should be consulted to initiate the most appropriate treatment, which may include the use of anti-inflammatory drugs, physiotherapy or surgery. In addition, it is important to have an anti-inflammatory diet including berries or citrus fruits, fish rich in omega-3s or green tea, for example, to help control inflammation and relieve swelling of the hands and fingers. 8. Tendonitis. Tendonitis is an inflammation that occurs in the tendons of the hands and fingers, causing swelling, pain, and tenderness. The main types of tendonitis that can affect the hands and fingers are Quervain's tenosynovitis, which affects the tendons at the base of the thumb, and trigger finger, which primarily affects the tendons of the ring or thumb fingers. What to do? Apply ice packs to your swollen fingers and hand to help reduce blood flow to the area and reduce pain and swelling. In addition, you should consult the orthopedist who may indicate the use of analgesics or anti-inflammatory drugs, physical therapy or, in some cases, surgery. 9. Drop. Gout is a condition in which uric acid builds up in the joints due to a decrease in its elimination in the urine, leading to swelling of the hands and joints, in addition to causing pain, skin redness and the formation of small hard lumps in the finger joints. What to do? You should consult a rheumatologist to start the most appropriate treatment, which can be done with the use of allopurinol, probenecid or colchicine, for example, which help to decrease uric acid levels and reduce pain and swelling in the fingers and hand. In addition, it is recommended to have a diet that helps to regulate uric acid levels including fruits such as apples, oranges and strawberries, vegetables and legumes, as they help to prevent the accumulation of uric acid in the blood and increase its elimination through the urine. 10. Hormonal changes. Hormonal changes, especially estrogen and progesterone, that happen during the menstrual cycle, PMS or pregnancy, can cause swelling in the hands and fingers, due to fluid retention in the body. In addition, swelling in the hands and fingers is usually accompanied by other symptoms such as mood swings or headaches, for example, especially in PMS. What to do? Massage or lymphatic drainage can be done on your hands and fingers to help reduce swelling and prevent fluid buildup. In addition, it is important to keep the body hydrated and increase the consumption of diuretic foods such as melon and watermelon, for example. See the complete list of diuretic foods. 11. Heart failure. Heart failure occurs when the heart is not strong enough to pump blood that can accumulate in the arms, causing swelling in the hands and fingers. Swelling in the hands and fingers is usually accompanied by other symptoms such as swelling in the feet, excessive tiredness, shortness of breath and a feeling of pressure in the chest. What to do? Heart failure should always be treated with medication prescribed by the doctor and, therefore, it is advisable to follow up with a cardiologist. In addition, one should reduce salt intake and practice light physical activities, always under the guidance of the cardiologist. 12. Use of medications. The use of some medications can cause swelling in the hands and fingers, such as steroids, minoxidil or medicines to treat high blood pressure such as captopril, enalapril, lisinopril, amlodipine, nimodipine, for example. What to do? Follow up with the doctor who prescribed one of these medications to assess the dose or if it is necessary to change the treatment, for example. However, simple measures can be taken at home, such as lifting the arms, massaging or lymphatic drainage to improve blood circulation and prevent swelling of the hands and fingers. 13. Kidney failure. Kidney failure is a condition in which the kidneys do not function properly and therefore do not eliminate fluid from the body in the urine, which can lead to swelling of the hands and fingers, as well as the feet and face. What to do? Kidney failure must be monitored by a nephrologist so that the most appropriate treatment can be done. In some cases where kidney failure is at a more advanced stage, it may be necessary to undergo hemodialysis, as prescribed by the doctor. When to go to the doctor. Some symptoms may accompany swelling of the hands and fingers and require medical attention as soon as possible and include: swelling happens suddenly, Swelling in one hand only. Redness of the swollen hand or fingers. Shortness of breath. Cough or expectoration. Other symptoms such as fever or tingling. In these cases, the doctor may order tests such as blood tests or echo Doppler. For example, to identify the cause of the swelling of the hands and fingers and recommend the most appropriate treatment.